Okay. First of all, I'll show you the basic kidney. Okay, see here. So let us see this kidney. Okay. So see everybody. Let us have a look. So see the surfaces first of all. Leave about the borders. Borders you can easily identify. So which surface is convex over here? Anterior. So this is the anterior surface and posterior surface is flat, right? And we have two poles over here. Two poles over here. Upper pole and lower pole. How to identify? Okay. So first of all, this is the ureter. Is it not directed downwards over here? This is the ureter, and these must be the vessels over here, right? And this is the pelvis of the ureter, which is absolutely on the posterior aspect. This is the flat posterior surface. Towards the posterior aspect is the pelvis of the ureter. Is it not? Towards the posterior surface is the pelvis of the ureter. So if I turn it upside down, you can see a kinking over here. Would you be able to see that? It is folding of the pelvis of the ureter. This is the folding of the pelvis of the ureter, folding of the pelvis of the ureter, which is nothing but the kinking. So if you keep it in a wrong direction, this kinking will occur. Okay. So if you keep it in normal direction over here, there will not be any kinking over here. Would you be able to see that? Yes, so we have identified the anterior surface and posterior surface, and this is the ureter which is in the normal direction over here. So obviously this must be the upper pole and this is the lower pole over here. And this is the lateral border and this part is the medial border over here. Okay. Why medial border? Because the hilum and the sinus are situated towards this aspect. That's why it is nothing but the medial border. Okay. So what might be the which kidney it might be? Obviously the right kidney. Ureter is facing towards the medial aspect. Lateral border is towards the lateral aspect. Anterior surface is convex anteriorly and posterior surface is flat. Upper pole and lower pole. And sinus of the kidney over here. And see properly over here. This sinus is having the adipose tissue. Could you see that? Which fat it might be? Which? Perinephric fat. It's not paranephric fat. Paranephric fat will be towards the posterior surface, in between the what is it? Quadratus lumborum and the posterior surface. So it is present over here. Okay. Here will be the psoas major. There is no chance of paranephric fat present over towards the sinus of the kidney over here. So this fat, whatever it is present over here, could you able to see these yellowish spots over here? Yellowish spots. Try to see towards the sinus. This is the yellowish spots. Try to see.
Yes, sir.
Okay, there is a fat in the sinus which is nothing but the perinephric fat, not paranephric fat. Okay. This yellow color dots over here, multiple yellow color dots over here. Those are the fat, perinephric fat within the sinus of the kidney over here. Got it? So the false fascia of the kidney, false renal fascia, nothing but the fascia of Zerota will be going over here and over here, Okay. So one more thing, the posterior layer of the false capsule will be attached to the vertebrae posteriorly, but anteriorly it will be continuous on either side. Okay, I forgot to tell that point. Posterior layer will be attached to the vertebra, but the anterior layer will be continuous in front of the vessels, nothing but the aorta and vena cava, because aorta and inferior vena cava also behind the peritoneum, not in between the peritoneum. Okay, right. Sorry. Okay. Try to see the vein, artery, and pelvis. This is the vein which is thin walled over here. Could you see that? And this is the artery. This is the artery. Could you see the lumen over here? This is the artery. Vein, artery, and ureter, pelvis of the ureter. See properly, everybody. This thin walled structure, this thin walled structure, this thin walled structure is a vein. Okay, and this lumen with the thick wall is the artery, and this is the pelvis of the ureter. Okay. This part is the pelvis of the ureter. Vein, artery, and pelvis of the ureter. Got it already, right? See here. This thin wall is the vein. Thin wall. This thin wall. Could you see that? This thin wall with the lumen over here, that is the vein over here. Got it? Right? This thin wall is the vein over here. And this thick wall with the lumen over here is the artery. Could you see that? This is the artery and this is the pelvis of the ureter. I have already shown you. Got it already? Have you seen it? Right? So this is the vein. See here, thin wall, vein over here. This thin wall is the vein. Could you see that? This lumen and everything. That is the vein, and this lumen with the thick wall is nothing but the artery over here. Could you see that? And this is the pelvis of the ureter. This is the pelvis of the ureter. Okay, can you see that? Right? You see that? This is the vein over here. This thin one is the vein. This is thin one vein over here, and this thick one artery over here, and this is the pilus. Vein, artery, and pilus of the urine. Okay. So how to keep it in anatomical? So we have found out the borders and surfaces and everything. Now how to keep it in anatomical position? Because this is the right kidney over here, so you have to hold it with the right hand. It is not midline structure. Okay, right is right, left is left. Okay. So you have to how you are supposed to hold it with the right hand, and the upper pole must be facing towards the medial aspect, and lower pole must be facing towards the lateral aspect. And one more thing, the anterior surface must be facing anterolaterally in this manner, because this kidney is going into the paravertebral gutter over here in this manner. Okay, in front is the renal veins and arteries over here, but here the posterior surface will be within the paravertebral gutter over here. So anterior surface is facing anterolateral. That's why transverse axis is facing in this manner, laterally and posteriorly over here. Got it or not? Right? So you have to hold it in this manner, only with the right hand, not with the left hand. Okay. Right. Now with the composite viscera, not from the composite viscera, you can say. So how to keep it in anatomical position? Let us see that. It was given, huh? Sure. Then tell me how to identify. Okay, Veena cava will be in front. Okay, fine. Yeah, that's true. Just yes, some anomaly might be there. Now tell me how to keep. Tell me. Okay. This one is going from the outdoor direction. This is this one. Yeah, okay. Yeah. Keep it in anatomical position. That is what
স্ট্রাকচার আকার লুজ হয়ে So this part is torn, that side is okay.
So based on the anatomical alignment of the veins and arteries, just try to keep it in anatomical position. That is easiest.
This is what happened. Now this is okay. This is okay.
Okay. So now
from the front. So from the front. This one. Nice.
Okay. So now tell me how you kept in anatomical position.
The vein is standing in the front,
Okay.
the aorta in the back, and the pelvis will be behind.
And vein will be standing in front. Okay.
And
if I turn it in this manner.
And we have to see from the posterior aspect that the ureter is not kinking.
Exactly.
If we hold it like this also, the same structures will be followed with the vein, but ureter will be kinking from this place.
Exactly.
And this should not happen.
Yeah.
So
And one more thing, the vena cava, the major veins, nothing but the vena cava will be on the right side of the vertebra. Sorry. And aorta will be on the left side of the vertebra. So this one is one more point. Okay. And the ureter should not be kinked over here, and convexity of the anterior surface will be in front, and flat surface will be on the posterior aspect over here. Okay. That's very good. This is the actual anatomical position. Very good. Very good. Very good. Okay, you understood your friend's point of view, no? Right? Yes. Yeah, sure. Okay, let us see that. So first of all, the vena cava, which is thin walled over here. See properly, everybody. Among these two vessels, you could able to see. This one is one vessel, and this one is another vessel over here, right? This one is one vessel, and this one is another vessel. One is thicker. Could you able to see that? This is thicker vessel. Could you able to see that? This is a thicker vessel. This one is a thicker vessel. Could you able to see that? This one is a thicker vessel. Could you able to see that? Right? The wall. Look at the wall over here, thicker wall. Okay. And let us see the thinner wall over here. Could you able to see the difference between these two walls over here? This is thin wall and that is thick wall. Could you able to see the difference? Right? Yes. Right? Thin wall and thick wall. In this manner, you are supposed to identify. This is thin wall and that is thick wall. Okay. Whatever I'm holding with the forceps is the thin wall structure. Thin wall structure over here, and this vessel is thick wall structure over here. Could you able to see that? Could you able to see that, everybody? Could you able to see that, right? Everybody have seen it? This is thin wall structure and this is thick wall structure. So obviously this must be inferior vena cava and this is the aorta. So what might be this vessel over here? What might be this vessel? This vessel. Renal vein. Okay. Which vein must be? Which vein will be longer compared to the left? Because it should cross all the way the vertebra and goes towards the left kidney. So left renal vein is longer. And which renal artery is longer? Right renal artery is opposite, obviously, because aorta is situated towards the left side, so it should cross all the way the vena cava and goes towards the right kidney. Okay. So now we have found out the inferior vena cava with the two pulmonary veins on either. Sorry, renal veins on either side. Okay. So if this is the left renal vein, what are these two veins over here? Yeah, exactly. One is suprarenal vein over here, and one is gonadal vein over here. Gonadal vein over here. Remember this properly. These suprarenal vein and gonadal vein on the right side will be directly draining into the inferior vena cava, but left renal vein will be draining the left gonadal vein and left suprarenal vein. This is very much important. Okay. And these two structures are the renal arteries, because these are arising from the aorta. So these must be renal arteries over here. Renal arteries, obviously. Okay. So somebody guess what might be this vessel? Exactly. Very good. Superior mesenteric artery, because the pancreas will be going over here in this manner. So behind the pancreas is a superior mesenteric artery. Very nice. Very nice. This is a superior mesenteric artery. Just above the renal arteries, you can see that. Okay. Right. Now, ureter. Ureter on the posterior aspect, right? Ureter will be on the posterior. This is the pelvis of the ureter. It is not kinking at all. Is it not? It is absolutely falling downwards, right? This is the pelvis of the ureter. Pelvis of the ureter, whatever you are seeing, the hanging structure, that is the pelvis of the ureter and ureter also as a whole. Okay. So along with the renal arteries and renal veins over here, vein, artery, and ureter. Okay. So we have identified these are the posterior aspects of the ureters. So obviously these must be on the, in anatomical position, these must be on the posterior aspects, and no kinking of the ureters occurred over here, and inferior vena cava is on the right side and aorta is on the left side. So we have found all the sides and the structures in perfect alignment and how to hold it in anatomical position. Okay. So the left kidney must be a bit above, right kidney must be a bit below because of the presence of the liver. Okay. And the upper poles must be 2.5 centimeters away from the midline, and lower poles must be 7.5 centimeters from the midline. And then the anterior surface are facing anterolaterally in this manner. So you have to hold it in anatomical position in this manner. Got it? So you have to hold it in this manner. Anterior surface must be facing anterolaterally because they are going, the posterior surface are going into the paravertebral gutter. Understood or not, everybody? Right, right. So in this manner you are supposed to put it in anatomical position. First of all, identify the inferior vena cava and the abdominal aorta and the kinking or non-kinking of the ureters, so that you can put it in anatomical position, perfect anatomical position. Okay. Then let us see the things over here. Focus on here, everybody. I show you one by one in a group. See here, This is from the surface over here. There will be the capsule and everything over here, and this is the sinus, and this part is the hilum. Could you able to see that? This part, this is the medial border, and this is the thing which will be becoming concave over here, and again convex over here. And this part is the hilum of the kidney. Not this part is the hilum of the kidney. This part is the hilum of the kidney. This entire part is the renal sinus, where the ureters and you can see the minor calyces are going over here. These are the minor calyces, and this is the major calyx, which will be going further and forming the pelvis of the ureter. Okay, and see properly. Let us see that. I'll show this group again. Okay, try to see that, everybody. Okay, so this is the cortex. The outermost area is, I'll show in the another group also, nothing more. Okay, so this outermost area is the cortex. Whatever you are seeing, this part, this pale area is the cortex over here, cortex of the kidney over here. And this alternate dark and light band sort of is nothing but the medulla over here. And clearly you can see this is a renal pyramid, which is like a pyramidal in shape or triangular in shape. Okay, this is the base of the pyramid, and this is the apex of the pyramid. This area is called the renal papilla over here. And here, which is continuous with the minor calyx in this man. See here, if this is the pyramid, one pyramid, these are the minor calyces over here. This is one minor calyx, this is another minor calyx. Both will join together and form one major calyx over here. Okay, so this one major calyx and this is another major calyx. Both will join together and join with other major calyces and form pelvis of the ureter over here. Okay, so in between the so this pyramid along with this part of the cortex is termed as lobe, renal lobe over here. Okay, in between the two renal lobes, this area is termed as the renal columns over here. This is one column, this is another column, this is another column, this is another column. Okay, renal columns, where the interlobar arteries will be present over here and goes above the pyramids and divides into arcuate arteries in this manner, and they again divide into interlobular arteries. Okay, try to see properly. The grayish black lines over here are the medullary rays over here. Could you able to see that? The grayish black lines over here. Could you able to see that or not? Right? See here. These grayish black lines over here in between the pinkish colored structure is nothing but the medullary rays. Could you able to see the grayish black lines, right? See here. The grayish black lines. Could you able to see the grayish black lines over here? Right? Those are the medullary rays. See properly over here. This grayish black lines. Could you able to see these grayish black lines? Right? Those are nothing but the medullary rays over here. Could you able to see that, everybody? Could you able to see that, everybody? Whoever couldn't able to see properly, just above the bases of the pyramids, try to see the grayish black lines radiating. Could you able to see that? No, okay. I focus on one ray. See properly over here, the grayish black line. Similar sort of lines will be on adjacently. Could you able to see that? Could you able to see that? Right? This line, I focus on two lines. These two lines over here, these two lines, could you able to see that? Two grayish black lines, right? Those are the medullary rays. Could you able to see that? These two grayish black lines, exactly just below the forceps. Could you able to see that? Those are the medullary rays. These lines, could you able to see that? These two lines over here, those are the medullary rays. Could you able to see that? See the grayish black lines over here, exactly over the one grayish line, black line. Could you able to see that? Grayish black lines over here, just above the bases of the pyramids. Could you able to see that? Just above the bases of the pyramids. Could you able to see that? These grayish black lines over here. Could you able to see that? These grayish black lines. Those are the medullary rays. And see everybody, this part is the sinus. This part is the sinus over here, which is a part of the kidney. Okay, which lies deep to the deep stratum of the renal fascia over here. Okay, this is the sinus of the kidney, which lies deep to the deep stratum. Deep stratum of the renal fascia will be over here in this manner. The deep stratum of the renal fascia will be over here, joining both posterior layer and anterior layer over here in this part. And the anterior layer will be continuous further, and posterior layer will be attached to the vertebrae on either sides over here. Got it? So this part, wherever my phalanx is present, distal phalanx is present, that is the area where the hilum of the kidney is present over here. But deep to that, this part is the sinus of the kidney, this part is the hilum of the kidney over here. Got it? So this part is the sinus of the kidney over here, and this part is the hilum of the kidney. Not this part is the hilum over here. Got it? See here, this part is the sinus of the kidney, this part is the hilum of the kidney over here. Right? So these are the things which are supposed to be identified. Got it or not, right? Everybody? Huh? Clear? Yes, sir. That's all. We'll see the rest of the